Next speaker is
Thank
Dr.
you.
Smruti Rekha PRIYADARSHINI.
Before starting the video, I have a video to showcase. Before starting a video, I'd like to just brief that this is about neurotrophic keratopathy. We know that till now we have been treating neurotrophic corneas with lubricating eye drops,
Please
amniotic
stay back.
membranes,
Dr. Lokanath. I'm sorry.
and now we want to find a cure for that. We want to treat the underlying condition so that um, we treat the cause and not the effect. Hello everyone, I will be discussing a case of corneal anesthesia following varicella zoster infection managed successfully by indirect corneal neurotization technique. A 24-year-old female was presented to us in 2007 with chief complaints of white spot on the black portion of the right eye since childhood associated with on and off redness. There was history of chickenpox infection during childhood. Visual acuity was counting finger close to face and cornea showed a hypertrophied vascularized scar. The patient again presented in 2019 with pain and redness of 1 week duration. There was minimal conjunctival congestion and cornea showed a scar with an overlying epithelial defect. A diagnosis of neurotrophic keratopathy stage 3 was made and corneal scraping and glue BCL was performed. At 1 month post-op, a central vascularized leukomatous corneal scar was noted. The corneal sensations were completely absent. Considering the prolonged history and clinical findings, corneal neurotization by the indirect technique was planned. The corneal sensations were checked, followed by checking the dermatome supplied by the nerves. Dissection and mobilization of the sural nerve was done. Then the contralateral supratrochlear and the supraorbital nerves were isolated and they were identified. Subcutaneous incision was made and a tunnel over the nasal breech was constructed to the ipsilateral eye. The sural nerve was passed through this tunnel. Further, a blepharotomy tunnel was created and the nerve was passed into the superior conjunctival fornix and further to reach the perilimbal area. The nerve was dissected to expose 4 to 6 fascicles. A 360-degree peritomy was done and a sclerocorneal pockets were made 1 millimeter into the cornea. These nerves were then dissected at appropriate length and passed into the sclerocorneal pockets. Fibrin glue was applied and the conjunctiva was closed using 80 vicryl sutures. The other end of the sural nerve was dissected and end to side anastomosis with the supratrochlear nerve was performed and the blepharotomy incision was closed. At 1 year post neurotization, the patient reported that she could appreciate the installation of eye drops in her right eye. From the date of surgery, she had only one episode of epithelial breakdown which was managed conservatively. Sensation has increased in all quadrants ranging from 25 to 60 mm except the center. Vision potential checked with scleral lenses improved from counting finger close to face to 20 by 320, and we have discussed with her the option of lamellar keratoplasty for further visual rehabilitation. Corneal neurotization addresses the underlying pathophysiology of neurotrophic keratitis and can be considered as a preliminary step before further interventions such as keratoplasty.
Thank you so much. Thank you, Dr. Smruti. Any question?
When do you expect the corneal sensation to come back?
As in literature, it has been reported that the neurotization, the rate of neurotization is usually 1 millimeter per day, but it doesn't happen in real time. So normally it takes more than 6 months for the neurotization to start, but in our case we saw that it took more than a year for the and even after 4 years also the center was not as good as the periphery. So I think it will take some time, and maybe this case was one of the first cases that I had done. So maybe more of surgical handling. And
if one neurotization fails, is there any scope for repeating the procedure again?
Yes, we can do. It is not that we cannot do. We can always do another one, but we have to again counseling the patient for such a big surgery would be difficult. Thank you.
Thank you, Dr. Smruti.